Fibroids is an gynecological condition, reproductive health issue. Look at this picture, shows that fibroids in uterus, ultrasound findings, hysterosalpingography findings, and MRI. Look at this, a detail going on. Introduction. Fibroids, also known as uterine fibroids or leiomyomas, are non-cancerous growths of the uterus that often appear during childbearing years. While they are generally benign, fibroids can cause a variety of symptoms and complications that may require medical attention. Definition. Uterine fibroids are solid, smooth muscle tumors of the uterus. They vary in size, number, and location within the uterus and can be classified based on their position relative to the uterine wall. Types. 1. Intramural fibroids. These grow within the muscular wall of the uterus. 2. Subserosal fibroids. These project to the outside of the uterus. 3. Submucosal fibroids. These protrude to the uterine cavity. 4. Pedunculated fibroids. These are attached to the uterine wall by a stalk. Causes. The exact cause of fibroids is unknown, but several factors may influence their development. 1. Hormones. Estrogen and progesterone, which stimulate the development of the uterine lining during each menstrual cycle, appear to promote the growth of fibroids. 7. Genetic changes. Many fibroids contain changes in genes that differ from those in normal uterine muscle cells. 3. Growth factors. Substances that help the body maintain tissues such as insulin like growth factor may affect fibroid growth. Risk factors. 1. Age. Fibroids are more common as women age, particularly during the 30s and 40s through menopause. 2. Family history. If a woman's mother had fibroids, her risk of developing them is higher. 3. Ethnicity. African American women are more likely to develop fibroids than women of other racial groups. For obesity, women who are overweight are at high risk of fibroids. 5. Diet. Eating a lot of red meat and ham is linked to higher incidence of fibroids, while a high intake of green vegetables appears to protect against them. Complications. 1. Heavy menstrual bleeding can lead to anemia. 2. Pain, pelvic pain, lower back pain, and pain during intercourse. 3. Bladder issues, frequent urination or difficulty emptying the bladder. 4. Reproductive issues, infertility, pregnancy complications, and multiple miscarriages. Pathophysiology. Fibroids develop from the smooth muscle cells of the myometrium. The pathogenesis involves genetic mutations, hormonal influences, and growth factors, leading to the proliferation of smooth muscle cells and the formation of fibrous connective tissue. Signs and symptoms. 1. Heavy menstrual bleeding. 2. Prolonged menstrual periods. 3. Pelvic pressure or pain. 4. Frequent urination. 5. Difficult emptying the bladder. 6. Constipation. 7. Backache or leg pains. Diagnosis. 1. Pelvic exam, physical examination of the pelvis. 2. Ultrasound imaging to confirm the presence of fibroids. 3. MRI detailed imaging to determine the size and location of fibroids. 4. Hysterosonography uses saline to expand the uterine cavity for better imaging. 5. Hysterosalpingography, X-ray test that involves injecting a dye into the uterus. 6. Hysteroscopy involves inserting a small lighted telescope through the cervix into the uterus. Nursing diagnosis. 1. Acute pain related to uterine pressure. 2. Ineffective coping related to chronic conditions. 3. Anxiety related to diagnosis and potential fertility issues. 4. Risk for fluid volume deficit related to heavy menstrual bleeding. Management. 1. Monitoring regular checkups if fibroids are small or asymptomatic. 2. Medication, hormonal treatments to regulate menstrual cycle and shrink fibroids. Pain relievers, iron supplements. 3. Non-invasive procedures, MRI guided focused ultrasound surgery. 4. Minimally invasive procedures, uterine artery embolization, laparoscopic, robotic myomectomy. 5. Surgical procedures, hysterectomy, removal of the uterus for severe cases. Treatment. 1. Medications, GnRH agonists, progestin released intrauterine device, IUD, oral contraceptives, non-steroidal anti-inflammatory drugs, NSAIDs. Second, non-surgical, uterine artery embolization, MRI guided focused ultrasound. 3. Surgical, myomectomy, hysterectomy, endometrial ablation. Psychosocial medicine. 1. Emotional support, counseling and support groups for emotional and psychological support. Second, education, providing information about the condition, treatment options, and coping strategies. 3. Holistic care, addressing the physical, emotional, and social aspects of living with fibroids. Prevention. 1. Lifestyle changes, maintain a healthy weight, exercise regularly, and eat a balanced diet rich in fruits and vegetables. 2. Regular checkups, early detection through regular gynecological exams. Conclusion. Uterine fibroids are a common gynecological condition with various manifestations and complications. Early detection, appropriate management, and comprehensive care can significantly improve the quality of life for affected women. Continuous research and advancements in medical treatments offer hope for more effective and less invasive treatment options in the future. Thank you. Have a nice day.